further delay, I will turn things over to Mark Ellis.
Thank you, Stan. Hi, I'm Mark Ellis. I work in the Defense Health Agency. My colleagues here in the Defense Health Agency, and along with folks from our TRICARE contractors, are here to answer your questions. We have a couple of slides per each area we'd like to go over briefly, but we really would love to get to your questions. So without further ado, let me move to slide number 2. The disclaimer about the hyperlinks do not constitute endorsement by the DoD of the website or the information, products, or services contained therein. For other than authorized activities such as military exchanges and MWR sites, the DoD does not exercise any editorial control over the information you may find at these locations. Such links are provided consistent with the stated purpose of this DoD-sponsored webinar. All right, I'm done with the legalese. Here's the real deal. The #1 website you want to remember with anything regarding the TRICARE medical and dental benefits is tricare.mil. The other links that you'll see in our PowerPoint presentation are authorized DoD links to a DoD website or authorized TRICARE support contractor website. With that in mind, let's move on to the agenda. So, as I said, will be brief introductions. Each subject matter expert will introduce themselves for the areas that they're going to cover. Moving on to slide number 4, upcoming changes to TRICARE. So the #1 thing we'd like you to know is there is a TRICARE open season enrollment period from 12 November through 10 December. Open season is an annual period when you can enroll or change your TRICARE coverage for the next year, in this case for coverage starting on 1 January 2019. If you choose to do nothing, either your TRICARE Prime or your TRICARE Select coverage will continue for 2019. Remember, you can only enroll in or change your coverage between Prime and Select during the open season or because of a qualifying life event. And there's the web address, tricare.mil/open season, to learn more information about that. The next upcoming change, I'd like to introduce Ms. Ann Breslin, who's going to talk to you about the Federal Employees Dental and Vision Program.
Good afternoon. As Mark said, my name is Ann Breslin. I'm in the TRICARE Health Plan. The TRICARE Retiree Dental Program will end this year on December 31st. But don't worry, there is another plan available to you. You will be eligible for the Federal Employees Dental and Vision Insurance Program. This is a program run by the Office of Personnel Management. It has the same open season period that we have for TRICARE this year, and it's November 12th through December 10th. If you enroll in the dental programs available through Fedvip is the acronym. It's Federal Employees Dental and Vision Insurance Program. The coverage will begin January 1st of 2019. To keep yourself up to date and to educate yourself on the various options, as there are 10 dental carriers with either high or low options available, so there's lots of choices. There's a website, tricare.benefeds.com. It's on the slide at the bottom. If you go there and sign up for alerts, you can put your email address in there, and you can receive notices when updated information is added to the website. So it's continually being updated to provide additional information. Currently, there's information on how to compare your dental plan choices. I'll just add one more thing that you'll find on that website, that folks that are enrolled in a TRICARE health plan will also be eligible for vision. That's the retiree families and their eligible dependents, as well as active duty family members. More details are on that website. And I'll turn it back over to Mark.
So in addition to the website about learning more about the upcoming Fedvip changes, we do want you to be prepared for the changes that come along. So on slide number 6, there's some websites there on how to update, sign up for a DoD self-service logon. That helps you log on to secure websites to update your enrollment and eligibility information. and update your personal information in terms of mailing address and phone numbers, email addresses. And you can also sign up on the TRICARE website to get information sent to you. So again, TRICARE.mil/changes. You'll learn about the latest changes that are upcoming to the TRICARE Health Plan. There's frequently asked questions, as well as a general take command of your health care. And in general, that's what we want to really emphasize to our beneficiaries is, this is the time for you to take command of your health care. The new laws require we as military beneficiaries to understand what our health care eligibility is, and to make sure that if we desire to have TRICARE coverage, whether it's medical or dental, to enroll at the appropriate time. So let me turn the mic back to Ann to talk about TRICARE for Life.
Okay. Hopefully many of you understand that TRICARE for Life is the name of a program. It is a program for individuals who are eligible for TRICARE and also have Medicare Part A and Part B. There are websites and links provided here, points of contact for information, and I'll be happy to answer questions further along in the program. Next up is Brian Smith.
Yes, hi, good afternoon or good morning, depending where you are. My name is Brian Smith. I am the program manager for the Reserve Component Health Plans, and just some brief mentions here for today. With regards to National Guard or Reserve members, the TRICARE coverage is based solely off of your duty status, as well as what your personnel loads in the RCC PDS and ultimately feeds into DEERS. That being said, the three main statuses that folks are most familiar with is being on military duty for less than for 30 days or less. That means even though you received orders, again, for 30 days or less for any type of service, be it AT or some activation that is during that time period, means that you are not considered an active duty service member. The activated status, duty status, is for those reserve component or Guard reserve members activated for more than 30 days, would then obtain, as well as their eligible family members, eligibility under as an active duty service member and active duty family member. And then lastly, deactivated is once that activation period were to end, you would revert back to either your drilling status or whatever reserve component status you were in prior. And then along those, as Mark pointed out, TRICARE.mil and eligibility will show and reflect what, with regards to these statuses, what health plans you would be eligible to either purchase or enroll in. So another, just wanted to emphasize as far as the dental, when the Guard or Reserve members on duty for more than 30 days, they themselves would fall under the active duty dental plan, and family members could remain in the TRICARE dental plan with a discounted monthly premium. I'll let our dental folks get into more on that. And then when they're not on active duty, then they could remain in the TRICARE dental program with back to the normal non-discounted monthly premiums. And then lastly, whether you're covered by TRICARE Reserve Select, TRICARE Retired Reserve, on active duty for more than 30 days, or in the Transitional Assistance Management Program, you do have access to TRICARE pharmacy benefit, be it in a MTF or with a retail pharmacy. And then you'll note over on the right the bullets to the links for TRICARE Reserve Select, TRICARE Retired Reserve, Reserve Integration, and MNRA also have a website, people.mil, where there's a TRICARE link that can direct folks to their reserve component for issues with their eligibility matters. And then lastly, the Beneficiary Web Enrollment. For those of you who may not be aware, but as of January 1, 2018, to purchase TRS or TRR, that is now done through the BWE. In addition to being able to do it over the phone or for overseas in a TRICARE service center. So that's all I have for now, and I'll stay on for questions later. Thank you.
And now we have Master Sergeant Wilkerson to talk about the TRICARE Overseas Program.
Hello, everybody. Like you said, my name is Master Sergeant Wilkerson. I am representing the TRICARE Overseas Program, which is administered by International SOS Government Services. The overseas region is one large region, but we're divided up into geographical areas. I work in the Eurasia, Africa, which is out of Simbach, Germany. You have Latin America and Canada, which is out of San Antonio, Texas, and Pacific, which is housed out of Okinawa, Japan. Each region has a specific regional call center, and those numbers are displayed on this slide. And next slide, please. On slide 10. Yep. So I'm here for the whole webinar, and if you have any questions, just chime up. Thank you.
Thanks, Master Sergeant Wilkerson. And now Mr. William Daly is going to talk about the TRICARE Pharmacy Program.
Good afternoon. As Mark said, my name is William Daly. I work in DHA, or Defense Health Agency, Pharmacy Operation Division. I am the Pharmacy Benefit Officer. And on the slide, you can see we're govern the TRICARE Pharmacy Benefit, which is managed by Express Scripts, Inc. And on this slide, you can see there are PLC point of contacts. If you're interested in home delivery or retail, you can always dial the number that's there. And we also have websites, which is the tricare.mil/pharmacy, and Express Scripts also have a website that you can refer to. And I'll be online to answer any questions regarding the TRICARE Pharmacy Program.
Thanks, William. Next up are the TRICARE Dental programs. We have a couple of different experts. I think Gene May's going to kick it off. So, Gene, over to you.
Hello, everyone. My name is Gene Mays with the Dental Care Office at DHA, and along with Mr. Doug Elsesser, we'll be addressing any questions you might have with the TRICARE Dental Program, or the Active Duty Dental Program, or the Retiree Dental Program. We also have Mr. Gregory Banks of United Concordia and Mr. Doug Schobel of Delta Dental on the line to help answer any questions. On slide 12, you've got the points of contact for United Concordia for the Active Duty Dental and the TRICARE Dental Program. And on slide 13, you've got the information for Delta Dental of California for the Retiree Dental Program. And just to reemphasize, Retiree Dental is going to end on December 31st, pending your enrollment in the Fedvip program during the open season of November 12 through December 10. With that, I think we're ready for questions, so I'll turn it back.
Okay, Stan, back to you to get us started.
All right, thank you, Mark. The first question reads, let's see, once retired and on Medicare A and B with TRICARE for Life, will there also be a need to enroll in any of the upcoming new Medicare Advantage programs which have been discussed recently in the papers?
There is not a need or a requirement to sign up for Medicare Part C, but that is your choice. If you sign up for Medicare Part C with Medicare Advantage plan, you have to receive all of your care through that plan. And in order to have any reimbursement from TRICARE, you would have to file paper claims for copayments. It would be the only thing that TRICARE could pay for. If you're using the original Medicare program, your providers file claims directly with the Medicare claims processors, who then electronically forward the claim to Wisconsin Physician Services, which is our current contractor processing claims for TRICARE beneficiaries that also have Medicare. That leaves you completely out of the paperwork process for claims. So I hope that's answered your question. Thank you.
All right, thank you. The next question reads, will copays for ABA be increasing in January 2019?
Hi, this is Mark Ellis. So the question is likely they are, because both the grandfathered beneficiaries, those are sponsors who joined the military before 1 January 2018, as well as Group B, those sponsors who joined the military on or after January 2018. We do annually adjust the co-payments based on the retiree COLA, cost of living allowance. For Group B and for Group A, they are adjusted based on an average historical cost. So the short version of answer is yes, we likely will not know the impact of the cost increases for the co-payments until the retiree COLA is released officially in mid-October. But they likely will be adjusted to start on 1 January 2019. Next question.
All right, thank you. Next question reads, we are currently enrolled in Delta Dental under the existing Trdp. If we transfer to the Delta Dental program offered under the new Fedvip, will we be considered an existing patient or a new patient with the 12-month waiting period before we become eligible for orthodontist coverage?
Well, this is Doug Schobel from Delta Dental and the TRICARE Retiree Dental Program. A good thing about the Fedvip program is there aren't waiting periods other than what you rightly point out, orthodontics. If you are transferring into the Delta Dental Fedvip plan from the TRICARE Retiree Dental Program, we will count that time served, so you will be able to get your orthodontic, the children's orthodontic care right away.
Okay, thank you.
Let me just add a little bit there, Stan. No one is transferred directly into a Fedvip program. You have to enroll into a specific dental plan. Delta Dental is one of the options, but there are also other options that cover orthodontia without a waiting period. You'd have to look at the details of those plans.
Okay, thank you. Next question. My wife is turning 65 and will be applying for Medicare Parts A and B, being a spouse of a retired veteran. Does she also qualify for TRICARE for Life? If yes, how does she apply for TRICARE for Life if it's automatic? And was it for me? As it was for me.
So there is no enrollment in TRICARE for Life. So as soon as someone has Medicare Part A and B, we receive that data from the Centers for Medicare and Medicaid Services, the agency that manages the Medicare program. So if your wife still meets any other TRICARE requirement for eligibility, once she has Medicare A and B, she'll automatically have TRICARE for Life.
Okay, thank you. Next question reads, I'm a retired U.S. Air Force reservist and I have TRICARE Prime Select. Hoping you would touch on this. We came from an expensive provider, Kaiser Permanente, and we've been with them for 30 years, a little scared of the change. Okay, so there was no question. All right. The next question is, for those beneficiaries that are not good with computers, will they be able to enroll over the phone? Will any reps be available for any of the companies to assist TRICARE employees who give educational briefs on these matters? Not sure about if there's really a question for the panelists.
If it pertains to Fedvip, the expectation is that they would sign up online. Okay, it doesn't mention Fedvip, but that is a possibility.
Let's see.
Stan, this is Brian. I also want to just respond to that aside of Fedvip, as far as TRICARE Prime, TRICARE Reserve Select, TRICARE Retired Reserve, and then Mark helped me on TRICARE Select or TRICARE Young Adult, but I believe all those health plans can be also done over the phone.
Yes, this is Mark Ellis. So for the TRICARE health plans, you can call the regional contractor, the servicing contractor, and communicate your enrollment requirements or requests to them over the phone. Go ahead, Stan.
Okay, thank you. I'm a retired civilian servant and getting dental and vision benefits from Fedvip through my civil service retirement. Is there any advantage to changing it so I would get those same benefits through my military retirement?
There's no advantage. It's the same program with the same cost share. So if you're in a plan that you're happy with, you don't have to make any changes. Alternatively, if you're not happy with it, you can make changes. It will be the same choices available to federal civilians as to the military eligible for the program.
Okay, thank you. What, if anything, do I need to do as I transition from TRICARE for Life, TRICARE to TRICARE for Life? For me, this will occur August 1st.
Oops.
If your birthday is August 1st, you're actually eligible for Medicare. If you're becoming Medicare eligible based on age, and your birthday is August 1st, you actually became eligible for Medicare July 1st. So if you haven't already signed up for Medicare, do it right away. There will be, your enrollment period is 7 months. It started, well, it's 3 months if you're, it gets complicated. So you're kind of late at this point. You want to sign up now. There will be a gap between when your Part A starts and when your Part B begins. And you're ineligible for TRICARE any month that you have A, Medicare Part A, and not Part B. Sign up right away. Please refer to the links provided on the page should you have questions. Thank you.
All right, thank you. The next question reads, if we retire and spouse changing from another insurance that has Express Scripts to TRICARE, can the existing scripts be transferred once we have the TRICARE Express Scripts account and log in, or will they need new scripts to be sent?
This is This is William Daly. Those prescriptions do have to be transferred to TRICARE, to Express Scripts.
Right, thank you. The next question reads, I'm a retired and use VA for health care. How does this work with TRICARE? What happens if I stop using VA?
Stan?
Yes.
Stan, this is William Dale. I want to backtrack. I misunderstood. They're trying to transfer scripts from Express Scripts, which is other OHI, to TRICARE Express Scripts, and that cannot be done. Okay.
Okay, thank you for that clarification.
So this is Mark. So to be clear, they'll need new prescriptions from their provider. Unlike transferring a prescription from one pharmacy to another, the provider to have these covered by ESI under the TRICARE program, they'll need new prescriptions from their provider sent to ESI, the TRICARE program. And our apologies, Stan, we were kind of cross-talking. So the next question, could you repeat it for us, please?
Sure, Will. The question reads, I'm retired and use VA for health care. How does this work with TRICARE? What happens if I stop using VA? Okay, so this is Mark Ellis. I'm going to start off, and then I'm going to let Ann jump in, because if it's
they're eligible for Medicare. Generally speaking, beneficiaries that are entitled to both DoD care and VA care can choose to go where they want. Generally speaking, the VA regulations and law says if it's a service-connected disability, you should get that pretty much free of charge at any VA medical center, or in some cases under the VA Choice Program with a civilian provider that's free. Again, it's up to you as the DoD retiree to choose where you want to get your coverage. If you're getting coverage, if you're getting care at a VAMC and it's not due to your service-connected disability, depending on income and other factors, they may charge you for that care, and some of that costs may be covered by the TRICARE program. But if you're Medicare eligible, let me toss that over to Ann.
So if you're Medicare eligible, you have TRICARE, and you are accessing care at a VA facility, Medicare cannot pay the VA cannot bill Medicare. So if you're receiving service-connected care, there isn't an issue. But if you're receiving care that's not service-connected, you are better off to go to a civilian provider, because TRICARE will only pay up to 20% of their allowable amount, and you'll be left with 80% of the bill. So for non-service connected care for individuals entitled to Medicare, seek care outside of the VA.
Thanks, Ann. Stan, next question.
Okay, thank you. Rollout of the TRICARE Dental for the to the federal program. When will access to the subject matter experts be available to go through current coverage with TRICARE retiree dental and compare with plans under the federal program? Even if using 2018 plan information, I'm concerned we will be left with figuring this out in November or December, and the system will be overwhelmed, resulting in a lack of assistance.
So this is an individual decision, and there will be no one to guide you directly to evaluate and make a list of the pros and cons. You need to look at how much care you think you might be needing. If you know you need a crown or something, that's something to consider. How much you're willing to spend, how much is the maximum allowable benefit offered by the plan. That varies widely. So it's time to make a chart and look at what's there today. I don't know how much the cost will vary come for 2019, but it's a good exercise to start looking at it now, because you're not used to making a choice. You're used to being told this is your only option. So it is a process, and it can be complicated. Use the website that's available, tricare.benefeds.com. There's lots of frequently asked questions with answers, and as you know, the plan information for 2018 is there. So do your best to educate yourself. If you find out you don't make a good decision this year, you get to try again next year and make another choice.
Yeah, and this is Doug Schobel. I just want to add one thing. For those enrolled in the TRICARE Retiree Dental Program, if you go to that website, the Trdp.org, there's a page, a transition page, where there's a fact sheet that juxtaposes the Fedvip, current Delta Dental Fedvip options anyway, for 2018 with the TRDP. So it just gives you a sense of how it compares. And like Ann rightly points out, there are a lot of different options. So, you know, with that said, I would certainly do your homework earlier than later, because there's a lot of information. Thank you.
Okay, thank you. The next question reads, what is TRICARE? Do one of the SMEs want to add something? Okay.
What's the question?
What is TRICARE?
Hello?
So this is Mark. So the question was, what is TRICARE?
No, I was getting ready to read the question, but then I heard something, so I stopped. So I thought maybe someone... Okay, so the question is, what is TRICARE policy for cosmetic surgery after approved RNY gastric bypass surgery?
Not unless driven by medical. This is Francine Forstill, and I work in the customer service section of the DHA. And elective cosmetic surgery following gastric bypass is not covered unless it is somehow driven by medical necessity. There may be instances in which, due to the significant amount of fat loss that the doctor has documented, continued infections with the tissue that overlies the thighs, and then that as a result would help justify possibly, but again, we're not going to guarantee anything. You can make the request to see whether or not that surgery would then be covered. But otherwise, in and of itself, elective cosmetic plastic surgery is not a covered benefit under TRICARE.
Thanks, Francine. Next question.
All right, thank you. When we enroll for the dental and vision coverage, when do they start taking out the premiums? Is that done automatically from our retirement check via allotment?
This is Ann. So there's several different ways that the payments can be taken. One of them is allotment. I don't have this committed to my memory, so our Delta Dental folks may be able to assist me. There was a second part of the question.
Yeah, as far as I understand it, this is Doug Schobel again. As far as I understand it, when you enroll through benefeds.com, that's the enrollment portal for the Fedvip plans, they will just establish your payments to continue to be taken out of your retiree pay.
And I believe if you check the frequently asked questions on the tricare.benefits.website, it specifically, I know I've read this, but I'm not sure if it's on those questions, when your current payments will cease under TRDP and when the Fedvip payments will start. If not,
yeah,
if
I
it's
believe
not there
the
now,
last
I'll make
payments
sure
for
it
the
is.
TRDP enrollees are going to be December 5th. Mm-hmm.
Does it depend on what method they're being paid?
I think the early December one is certainly going to be affecting those who pay directly out of their retirement check. As far as the check or credit card, I will have to double check into that. But yeah, I think like you said, it is going to be on the tricare.benefits.com.
Yeah.
So this is Mark Ellis. Just a kind of common response to questions about how should I pay my enrollment fees or premiums. Our experience over the last 33 years of doing this under the TRICARE program, the most secure method for you to make premium payments or enrollment fee payments is via allotment from a military pay, whether it's active duty, retired, or survivor benefit. Remember, under TRDP, it was by law that you had to pay your dental premiums via military allotment if feasible. We strongly encourage anybody who is paying, whether it's TRICARE premiums, TRICARE enrollment fees, or Fedvip premiums, to please, please, please consider doing that via allotment from a military pay account. It is the most secure and the most convenient way to pay. And also, if and when the contractors change, you don't have to call and give that allotment information, because by law, we can transfer that allotment information from the outgoing contractor to the ingoing contractor. About 140,000 beneficiaries put themselves at risk when we recently changed the regional contractors in the continental United States, because we could not transfer their banking or credit card information from the losing contractor to the gaining contractor. So please consider making all your premium and enrollment fee payments via military allotment. Thanks. Next question.
And Mark, if I may interject, this is Brian Smith. From the reserve component side, for TRS and TRR, the only means to pay your monthly premium payment for TRS and TRR are through an automated payment option of either a reoccurring credit card or an electronic funds transfer from your bank account. The reasoning, primarily more so for TRS, of why that those cannot be paid through an allotment, and we get that question often, is because it was decided and determined that if, in fact, a selected reserve member did not drill for a particular month or two, or whatever the scenario, and thus were not getting paid for that month, could create a financial hardship. So, while Mark pointed out very specifically and on the means and the need and suggestion to do through an allotment, just a note for TRS and TRR, those cannot be paid through an allotment, only an automated payment method. Thank you.
Okay, Stan, next question.
Next question reads, why doesn't TRICARE Prime cover travel vaccines for people who are not active military? Is it more expensive for TRICARE if people get sick because of not getting the vaccines?
This is Francine again, and the reason being, again, is that TRICARE is based on medical necessity. Your choosing to travel overseas is at your own personal choice. And so as a result, we only cover it for active duty service members and active duty family members who are on orders for overseas. Thank you.
Okay.
Thanks, Francine. Next question.
This is a rumor that Congress is going to extend the retirement age to 67 to save on the budget. What will happen to us who are going to be forced to go on Medicare by Congress if they extend the age before we reach 65 in 1.5 years? Will we still be on TRICARE Prime retiree?
So it's been many, many moons since the retirement age was changed, and it's continually changing. It used to be 65 for everybody. It is no longer. But that does not change your Medicare entitlement based on age. Medicare entitlement based on age is still 65. So if you are not collecting Social Security retirement at the age of 65, Medicare will send you a bill on a quarterly basis for your Medicare Part B premiums.
Thanks, Ann.
Okay, thank you. The next question reads, I'm an active duty select family member. What is the cost share for a routine eye exam? Do I pay deductible and copay, or is this covered at 100%?
Medicare member has no copay.
So for TRICARE Select,
This is Francine, and basically starting in 2018, as long as the TRICARE Select beneficiary uses a network provider for the TRICARE covered vision exam, there is no copay or cost share. If, however, they use a non-network provider, they may be subject to cost shares for some services, one of which is eye exams. It also, I mean, before it used to be that if you were select, i.e. standard, you couldn't get the eye exam, but all of the clinical preventive services now are being treated the same both for prime and select when the care is rendered by a network provider.
Thanks, Francine. Next question.
Next question reads, my husband is retired military and we are covered by TRICARE Prime for health care. He also works in civil service and our dental is currently covered by Fedvip. If my husband retires in March of 2019, would we have to wait to sign up for Fedvip dental until November of 2019, or will there be an immediate transition available to us when he retires from civil service in March?
Retirement is QLE.
Retires from civil service.
So when you retire from civil service, there's what's called a qualified life event, which gives you another opportunity to enroll. So you wouldn't have to wait. I forget. I think it's 60 days or something.
Yeah.
Following the qualified
Correct. 60 days. Yep.
Okay. Thank you. My specialist office visits are getting applied to my point of service deductible, even when I have a valid authorization for care. Is there a fix in place for this issue?
So it sounds like you're enrolled in TRICARE Prime, and you're getting care that you believe is authorized, but you're being charged point of service, and those out-of-pocket expenses are being applied to a POS deductible. Without getting into the specific circumstances, please contact the applicable regional or overseas contractor and ask them for assistance. If indeed the care is being authorized by the contractor, the claim should not be processed as point of service. Therefore, they shouldn't go to that deductible, but rather it should be applied only to your catastrophic cap. So please contact your applicable regional contractor for assistance.
All right, thank you. Next question. When will the Shingrix vaccine for shingles be available to us?
This is Francine, and it is based on the recommendation from the Health Preventive Task Force, and I'm not sure I had that name correctly. We are already covering the Shingrix vaccine, and the age is different. There is an age limitation on it, and I believe it starts at age 60, but TRICARE will pay for that vaccine.
So if you have any questions about that in particular, call your regional contractor.
Or go to tricare.mil/what's covered, and if you type in Shingrix or shingles, you'll get an answer.
Okay, thanks. Next question.
I'm currently undergoing orthodontic treatment using TRICARE Retiree Dental Program. I've made all of my co-payments, but TRICARE still has one payment remaining. Typically, the program pays this in January. Would TRICARE make this payment?
I'm sorry, I missed the first part of that. Was that regarding orthodontics?
Yes, orthodontic treatment using TRICARE Retiree Dental Program.
Okay.
And they've made all of the co-payments, but TRICARE still has one payment remaining. Typically, the program pays this in January. Will TRICARE make this payment?
That I will have to check on, and they can certainly also call customer service, but I'm not sure about that, so I just don't want to give a wrong answer. But I would certainly recommend that they call customer service and claims, or I can just get the answer and submit it, and then you can get it to anyone that you need to appropriately.
Okay, thank you. Next question. If we do not sign up for the new vision insurance being offered next year, will I still be eligible for the free yearly eye exam I get through TRICARE Prime?
The quick answer is yes. Next question.
Thank you. I'm a retired military in FEHB Fedvip as a spouse beneficiary. Will the TRICARE Fedvip cost the same as FEHB Fedvip? Will it provide different services? That's a tongue twister.
No, it's the exact same benefits and same costs for federal civilians as well as the military who will be eligible.
So this is Mark. This is one thing we want to keep emphasizing. The Fedvip program is being offered to eligible military beneficiaries under the Fedvip program. There is no TRICARE Fedvip program. Military beneficiaries, retirees will be offered their dental insurance through the OPM's Fedvip program, and most military beneficiaries other than active duty service members will be offered the opportunity to purchase vision insurance through OPM's Fedvip program. So, what we don't want you to do is call the TRICARE contractors and start asking questions about this. This is OPM's program. We've asked you to go to OPM's website, and when we get closer to the annual open season that OPM is going to offer for Fedvip enrollment, we definitely want you to go to their website, and if necessary, if you believe it's necessary, to call their toll-free numbers. Thanks. Next question.
Yes. Can you please tell us about the TRICARE program for special needs adult children who are incapacitated and how to apply for this?
So, hi, this is Mark Ellis. So I think you're referring to children who become significantly incapacitated before age 21 or before age 23 if they were a college student and eligible for, quote, regular TRICARE. The uniform services determine eligibility for incapacitated dependents past the age of 21 up to age 23. Contact your service military personnel office that's typically located at a rapid site, and they can provide additional information on the medical documentation that you'll need to provide to the personnel office, not to us, not to TRICARE, not to a military treatment facility. The uniformed services determine eligibility, including for those that are incapacitated dependents.
And this is Francine. I just want to add, try to do that again well before they lose their TRICARE eligibility, age 21, 23, because otherwise they will show up as not eligible, and that does have to go through a review process. DFAS is oftentimes involved in this because of the financial dependence on the sponsor that's required, and be aware also for incapacitated dependent status, there is a reevaluation done every 5 years.
Thanks, Francine. Next question.
Next question reads, why can't original Medicare AB Plus TRICARE for Life provide silver sneakers that Medicare C provides?
This is Francine. We get this question all the time in the customer service elsewhere, at least once a month. I'm not kidding. TRICARE by law can't cover exercise programs, which includes the Silver Sneakers program. So it's a very easy answer. We do encourage those who have access to a military installation. There are gyms and services available. But again, because this is an option fitness sort of thing, we can't cover it. Plus, again, by law it directly states we can't cover exercise programs.
All right,
Thanks. Next question.
My question is about pharmacy coordination of benefits when TRICARE is a secondary coverage to my Federal Civil Service insurance. I carried into retirement as Federal Civil Service retiree. Express Scripts is the pharmacy manager for both insurances. I'm using a retail pharmacy. All my prescriptions used to have a zero copay. Within the last several years, I have noticed a change. Now I have a copay even though the prescription is processed through both insurances. Has there been a policy change, or is it the pharmacy just charging me the copay to process the insurances?
This is William Daly. It's been mandated by the NDAA, the National Defense Act, and that is a requirement that they increase all copays in the TRICARE pharmacy benefit plan. Does that answer your question?
Yeah, Express Scripts on its federal plan and the military TRICARE plan. I was wondering why he still has a copay.
I think when he does the coordination of benefit, if it goes through his OHI, the other one first, then it comes to TRICARE. If the other program does not cover it, that, and he doesn't have a copay, then TRICARE shouldn't be having a copay for him either.
This is Francine, and another point of clarification on that is whether or not you have a copay by TRICARE is determined by how much the drug costs, how much the other health insurance paid for, and how much TRICARE would have paid for it. So now, as Mr. Daly indicated, that in the last legislation, there was a requirement that before generic was at no cost. Now there's a $7 cost associated with that. So it just depends upon how it all gets processed. So in some instances, you may have nothing. In other instances, you may be required to pay something.
So it's Mark Ellis. One last thing, as someone who has had FEHBP and TRICARE, please make sure while the pharmacy benefits manager for both of your plans appears to be ESI, you need to make sure that the retail pharmacy that you're actually getting your drugs from is part of both networks. So for example, it's been a couple of years now, but TRICARE ESI contract dropped CVS as authorized retail network pharmacy. So make sure that for both your FEHBP coverage and your TRICARE coverage that you're using authorized network pharmacies for both health plans. Otherwise, one of them may not pay at all. Anything else to add, William?
No.
Okay, thanks. Stan, back to you.
Okay, the next question reads, can I pay for my dental plan with a credit card monthly?
So today you can do that with TRDP. It is not an option under the Fedvip dental program.
Unless there is insufficient amount of money?
It is not an option whatsoever to use a credit card for Fedvip dental.
So they would have to use, so if they didn't have enough money in their retiree pay to pay their monthly premiums,
It'd be an automatic bank withdrawal.
it'd be a bank withdrawal. Okay, thanks for clarifying, Ann. Next question, please.
Okay, the question reads, why does TRICARE.mil breast pump state that suppliers are covered for 36 months, but the supply providers are refusing to refill any direction by Humana? But Humana also claims that they are not refusing to fill supplies. Multiple service members are no longer receiving the supplies that TRICARE are supposed to provide.
This is Francine, again from customer service. We haven't heard that up here at the DHA level. So I think, again, it's the question of, are you using network DME providers who would understand those rules, and or if you're purchasing like retail, that having to make sure that that claim comes in and gets appropriately adjudicated. If you are continuing to have problems with the regional contractor, again, call back to confirm, and if they can't strongly confirm what you are doing, go on TRICARE.mil, look under breast pumps, make sure that what's happening to you is what is stated as far as coverage, and if you need to, then also reach out to the TRICARE regional office. If you go into TRICARE.mil/contact us, I believe you can get their information.
Thanks, Francine. Next question.
Are dependent children eligible for dental and vision coverage up to age 26?
No, the coverage would end at 21 or 23.
Okay, next question. May I elect for my dental plan to be deducted from my retirement automatically?
So, well, if you're talking about Fedvip, when you sign up on the website, you'll indicate, there will be questions that you'll have to answer that will basically set up your payment. So you'll just follow the questions when you sign up.
And one of the options will be elect to pay by allotment from a military pay account. Don't make it mine, please. Make it yours. Thanks. Next question.
Next question. The Medicare Part B based on income is way more expensive than our present TRICARE Prime retiree, being $250 a piece as opposed to the $77 we pay on Prime for the both of us. I would like to know why we are being forced to go to Medicare as we enlisted 1980. We were promised free health care for life for the sponsor and the family member. Why can't it be grandfathered so that we keep our TRICARE Prime? The nearest base does not see retirees.
Okay. I know that some people were promised free health care for life. There is no statutory, no law, anything that supports that statement. TRICARE coverage ends at the age of 65 unless you are not eligible for Medicare Part A. So when TRICARE for Life was established in 2001, it was an expansion of the benefit. And the Medicare costs are established by Medicare, not by the Defense Department. So that is the requirement. In order to have continued care with TRICARE beyond the age of 65, you must have Medicare Part A and Part B.
Okay, next question reads, I will be experiencing a life-changing event in November by turning 65. I understand I will be switching to Medicare Part A and B, and that TRICARE for Life will kick in for Part D and whatever Medicare doesn't cover. Since she is younger, 57, am I correct that I will still be able to sign her up for TRICARE Prime.
That's correct. Medicare entitlement is an individual entitlement, and therefore a younger spouse will remain eligible for the other TRICARE programs.
Okay, next question. Will the dental and vision plans be available to those retirees overseas?
Yes, there are national plans that include overseas under the Fedvip program.
Okay, next question. What is the process when I have my son going to college in Boston while I still reside in San Diego? Also, review the process when I relocate east.
So this is Mark, and I'll ask Francine to jump in too. Generally speaking, we believe healthcare is local. And so if your son is going to be in Boston, we believe that he should sign up for a Prime or a USFHP plan while he's there, or sign up for TRICARE Select. In general, if you leave him enrolled where the rest of the family are, you're depending on your primary care manager to authorize care. In some cases, if it's primary care, it'll go point of service and you'll have additional out-of-pocket expenses. Speaking as a parent of adult children, this is the brave new world where they too, you, the parent, and the child need to learn how health insurance works in the real world, and getting care locally in the plan that best fits their needs while they're away from you, the ever-loving parent, is always a good thing.
And this is Francine. I'm just going to add on a couple of other things. Also, when your child goes away to college, their address changes in years, and let's say they don't live in a prime area but can be select. That means when they come at home for the holidays, and if they get sick, they can just be seen. They don't have to try to get an appointment at the MTF. If you think they need orthopedic care, you can go take them into a TRICARE authorized orthopedic provider. Also, maintaining your child enrolled in San Diego, is that what they said? Mm-hmm. San Diego while they're in Boston. You're also preventing someone else from being impaneled to that MTF who is in the local area and can get care. We've also encountered numerous situations where an MTF provider is unwilling to authorize care for a individual in a remote location because they haven't even seen the child. They can't guarantee, they don't know what really is wrong and if that's the appropriate care that should be authorized. So our recommendation oftentimes in these situations is really look at select if the child's going to be traveling back and forth. But again, every time they update their address in DEERS, they are offered that opportunity to re-enroll in Prime like over the summer. Again, that might not get them access to care at the MTF, but they would still be able to be Prime when they're back home.
Right. So one of the qualifying life events is a change in address. And we recognize that children away at college may have the opportunity to do that more than once a year. But we've made our policies as broad as possible to help meet the needs of these transitory moving beneficiaries. I think we have time for one more question.
I was getting ready to say that, Mark. Thank you. The next question and last question will be, when will TRICARE cover 3D mammograms for a diagnostic reason?
This is Francine, and we've had our medical benefits and reimbursement staff, thank you, review that. And right now, the clinical evidence shows that the outcomes from 3D mammography aren't any better than you would get from regular mammography. So therefore, at this time, TRICARE is not covering 3D mammograms. So it is under consideration, and it will be, if it becomes the standard of care out in the local community, it would then be considered for payment. And I believe that is part of the discussion right now.
And so just to take that up a notch, TRICARE does proactively look at new procedures, new drugs, new therapies on a continual basis. The law that governs that for us is it must be safe and it must be effective. And though sometimes there's things that are out there on the market today or things that providers are doing, until there's sufficient medical evidence that's been peer reviewed, we by law must make sure that that is both safe and effective for you before we make it a TRICARE benefit.
And we know that medical benefits is looking at it again at this time.
Right. Okay, so I
We've done
think,
periodic reviews of it, and here they're doing it
Right.
another one now.
all right, so thanks for your question, Stan. I think we're going to turn it back over to you to close this up.
All right, thank you, Mark. And I would like to thank our entire TRICARE panel for answering our questions today. I would also like to thank our attendees for participating in today's webinar. If you find yourself having questions after the webinar is over, or if we were unable to answer your questions today, please contact your regional contractor. Also, many of the answers to questions related to TRICARE benefits can be found on the TRICARE website at tricare.mil. This concludes today's webinar on Ask TRICARE. Thank you all for attending and have a great day.